Hello, Mrs. Johnson. It's good to see you again. The last time you were here, you set goals to manage your diabetes with healthy eating, being active, and taking your medication. How did your plan go?
Hello, Kayla. I was partially successful.
Tell me more about that, Mrs. Johnson.
Kayla, it's been pretty challenging to keep my glucose levels within the target range. Some mornings my levels are high. After I take a brisk walk, my levels are sometimes low. Last week, I had influenza and my blood glucose levels were all over the place. It was as if everything I tried did not work.
From what I understand, Mrs. Johnson, the areas where you are finding it challenging to manage your blood glucose are 1. Exercising, 2. When you are sick, and 3. Fasting blood glucose. Did I understand you correctly?
Yes.
Mrs. Johnson, I am willing to share some information that some living with diabetes having similar experiences find helpful. May I share it with you?
Certainly.
Mrs. Johnson, it is important to stay well hydrated before you exercise as well as when you are both well and unwell. When you are unwell, it is a good habit to drink 8 ounces of fluids such as bouillon every 3rd hour and to check your blood glucose level every 2 to 4 hours while your blood glucose level are elevated or until your symptoms subside. If you can tolerate it, you should continue to consume your carbohydrates in portion sizes of 15 grams. I'll speak with your doctor about adjusting your medication when you are unwell. Mrs. Johnson, contact your healthcare provider if your blood glucose level is greater than 300 after you've increased your fluids or if you are vomiting or have diarrhea. If you plan to engage in physical activity and your blood glucose level is less than 70, you should consume a 15 to 20 gram carbohydrate snack before participating in physical activity. If, however, you are going to engage in vigorous activity and your blood glucose level is greater than 300, be sure you are well hydrated and log your glucose levels before and after exercising.
Thank you, Kayla. I look forward to reading the information about solving the problems I've been having with managing my diabetes. Thank you.
Well-managed diabetes is effective in reducing the risk of developing complications related to diabetes. Would any of you be willing to share your thoughts on what you think risk reduction is? Thank you, Mrs. Johnson.
Well, I certainly want to reduce my risk of developing kidney disease like my uncle.
Yes, Mr. Singh.
Poor managed diabetes can lead to blindness, so it's important to manage it well to reduce one's risk.
Yes, Mr. Rivera.
Amputations. Poorly managed diabetes can lead to amputations. It's important to reduce one's risk.
Yes, Mrs. Khan.
One can reduce their risk for heart disease by exercising.
Exactly. Steps that one can take to reduce their risk include 1. Visit your doctor annually to have your A1C measured. 2. Every year have your kidneys checked. 3. Have your blood pressure checked at every doctor's visit. 4. Having your fasting lipid levels checked yearly. 5. Every year get your eyes checked. 6. Every year have your feet checked. 7. Eat healthily. 8. Be active. 9. Go to the dentist. 10. Get the flu and hepatitis B vaccine. And 11. Quit smoking. By doing those things regularly, you can reduce your risk of diabetes-related complications. Along with reducing risks, it is important to learn healthy coping skills so that you can manage your diabetes successfully. Would any of you be willing to share what healthy coping strategies you use to successfully manage your diabetes? Yes, Mr. Rivera.
The walking program I joined at my local recreation center is very helpful to me. Many of the participants also have diabetes and we support one another.
That's a healthy coping strategy, Mr. Rivera. Mrs. Khan?
I find prayer to be very helpful. Managing my diabetes can at times be stressful and I find my prayers help me.
Mr. Singh?
My family is supportive. They help me eat right and exercise. take my medication, make sure I log my blood glucose. They always tell me to stay positive. It's very helpful to me.
Mrs. Johnson.
I find the more I learn about diabetes, the more committed I am to take care of myself. I feel less stressed when I better understand my condition.
Living with type 2 diabetes can affect you physically and emotionally. Developing healthy coping strategies can help you deal with the stress that is common among those with type 2 diabetes. Whether it is being active, participating in faith-based activities, pursuing hobbies, or having the support of your family, friends, or support groups, healthy coping will assist you becoming successful at managing your diabetes.